Hi, my name is Melissa.
And I'm Maria.
Welcome to another episode of Dermal Talks. Recently, we did a video on how to care for your skin during winter, but today we are going to discuss how to care for your body, not only during winter, but all year round.
We look after our skin on our face every day, twice a day, but caring for our bodies is a vital part of our daily lives too. Our skin is a vital organ that covers the entire outside of the body. It not only forms a protective barrier against pathogens and injuries from the environment, but it's also an indicator of our health, our lifestyle, and our beauty.
Today, we are going to discuss a few common skin conditions, some of which are actually quite easy to not only treat, but to prevent too. The first skin condition we're going to talk about is keratosis pilaris, which is often referred to as chicken skin. Keratosis pilaris is a benign skin condition that is a result of a buildup of keratin, a hair protein in the pores that is blocking the opening of growing hair follicles. As a result, a small bump forms over where a hair should be. These bumps are commonly seen on the back of the upper arms, thighs, and the buttocks. Exfoliation is the most effective way to treat keratosis pilaris. I recommend using the 14% bioglycolic resurfacing body scrub by Jan Marini Skin Research. The AHAs in this scrub will not only help decongest the skin, but will exfoliate the dead skin cells and help to encourage fresh young cells to the skin surface.
Stretch marks. Stretch marks are essentially a type of scar caused by the stretching or shrinking of the skin due to puberty, pregnancy, or sudden weight loss or gain. Stretch marks occur as the collagen and the elastin in our skin ruptures due to the stretching of the skin. They often will appear as reddish, brown, or even purple ridges on the skin, depending on your own skin tone and how it fades from a pale silvery white over time. Stretch marks don't require treatment as they aren't painful or harmful, but some people don't like the way that they look on their skin. Like many types of scars, stretch marks are hard to remove completely, kind of like a broken vase, but you can minimize the appearance, especially when you treat them early. So this is often when you still see that they have a little bit of color to them. Treatments that a dermal clinician can provide include skin needling, which can help promote healing. It creates tiny puncture channels into the dermis and epidermis that promotes a regenerative response and the production of collagen. And then you've also got light and laser therapies. So a variety of light and laser therapies are available that aid to stimulate the growth of collagen and promote elasticity in the skin. However, speaking from experience, the results are minimal. You can get a textural change, but you can't remove it completely. However, stretch marks have a story, and it's something that you should learn to love. It is who you are, and quite often you shouldn't be ashamed of it.
Skin tags are painless, benign growths on the skin that are connected to the skin by a small, thin stalk. Most skin tags are tiny, typically smaller than 2 millimeters in size, and some can grow as large as several centimeters. Skin tags are often soft to touch and may be smooth and round, or may be wrinkly and asymmetrical. Skin tags are common in both men and women, especially in those over the age of 50, and can appear anywhere on the body, though they're commonly found in places where your skin folds, such as the armpits, neckline, groin, thighs, eyelids, and under your breasts. Tiny skin tags may rub off on their own with friction. However, most skin tags stay attached to your skin and generally don't require treatment unless they hurt or bother you. Then you may opt to get them removed. Dermal clinicians can remove skin tags through a treatment called diathermy. This is essentially burning off the skin tag with high-frequency electrical energy, and it's one of my favorite treatments as it's highly effective, quick, and mostly painless.
So ingrown hairs are essentially the result of a blocked hair follicle caused by a buildup of dead skin cells, which causes the hair to grow in a sideways or back into the hair follicle. When an ingrown hair develops, you may notice a small round bump called papules or small pus-filled bumps called pustules. Some people may be at a higher risk for ingrown hairs. For example, those that have the thick hairs, sometimes curly hairs, tend to develop ingrowns more often in comparison with those that have fine, thin hair, just because of the way that the hair grows. Ingrown hairs can be painful, they can get infected, and can even scar on certain skin types. So in order to prevent this, regular exfoliation of the area can help to dislodge that buildup and prevent future ingrown hairs. An exfoliant with glycolic acid, which similar to the one that Melissa had mentioned before, can help. And in worst case scenarios, your doctor may prescribe you with a topical steroid cream to reduce swelling and irritation around the hair. Now, do know that if ingrown hairs are something that you do face with on a regular basis, there are other options that you could do to minimize them with time. These particular tips and tricks are more to minimize them if you have the appearance of ingrown hairs at the moment.
Hyperpigmentation isn't necessarily a skin condition, but a term that describes skin that appears darker. It can occur in small patches, cover large areas, and even affect the entire body. The most common types of hyperpigmentation include melasma, sunspots, and post-inflammatory hyperpigmentation. Melasma is believed to be caused by hormonal changes and may develop during pregnancy. It is often presented in large patches that can be symmetrical. Sunspots or solar lentigos or liver spots are due to excess sun exposure over time and will generally appear on sun-exposed areas like the hands, face, and décolletage. Post-inflammatory hyperpigmentation is a result of injury or inflammation to the skin, including acne. Whilst hyperpigmentation is harmless, some people wish to get rid of it. There are a range of possible treatment methods that are performed by dermal clinicians. To prevent hyperpigmentation or to stop it from becoming more prominent, avoid sun exposure. Use a sunscreen with an SPF of 30 or higher to protect the skin and stop hyperpigmentation from becoming darker. Avoid picking at the skin. To prevent hyperpigmentation from forming after an injury, avoid picking at spots, scabs, and acne. Some cosmetic treatments to help hyperpigmentation include laser therapy, intense pulse light, chemical peels, and microdermabrasion. Hyperpigmentation is usually a cosmetic concern rather than a medical one. There are several treatments for pigmentation that can help lighten it. However, if there are spots you are concerned about or suspect that your pigmentation is changing, please consult your doctor for a thorough skin assessment.
Thank you all for tuning into this episode of Dermal Talks.
We hope you have enjoyed learning about some common skin conditions of the body.
If you have any episode requests, please leave a comment down below and don't forget to like this video and subscribe to the channel if you haven't already. Until next time, bye.
Bye.